Earlier in the show, we started to tell you about the CDA and the DHA's new mental health awareness campaign. The government saying that 1 in 5 people living in the UAE suffers from some kind of psychological problem. So it is taking steps to raise awareness and prevention, especially amongst young people.
We're joined now by Dr. Hussain Maseeh from the Community Development Authority and counseling psychologist, as well as friend of 20-something, Linda Sakar. Welcome to the show.
Welcome to the show.
Dr. Hussain, so what kind of mental problems are we discussing right now?
Well, concerning the campaign, we're not talking about mental problems. We're talking about positive mental health. We're trying to teach people, or trying to convey to people that how you live your life, how you think, how you deal with problems has direct effect on how you feel and your mood in general. So we're actually promoting a positive mental health rather than trying to talk about mental disorders or psychological problems.
And Linda, what are you seeing at your clinic, especially when it comes to young people?
Mostly what's prevalent at the moment, depression, seeing a lot of anxiety and a lot of stress-related issues to do with work, to do with sort of family pressures, relationship issues. So I would say those are probably the 3 most prevalent that I'm dealing with. And also given the age, I mean, we're talking about an age where people are sort of trying to gain their independence, forge a new identity. So again, you know, it's kind of finding, is it sort of developmental turmoil as opposed to depression? You know, it's kind of trying to distinguish between the two.
So, Doctor, we had a phone-in earlier in the show from a viewer. She's a 28-year-old female, expatriate, and she suffers from borderline personality disorder and bipolar. And we'll hear from her now, actually. This is what she had to say.
I suffer from anxiety and panic attacks off and on, and depression. With all of that, it comes under the category borderline personality disorder. The help I've had in the past has really been varied. I've been in government programs in Australia, which are for specific things like addiction and that, so I've been into those programs. I've been into rehabilitation centres to deal with anxiety and depression. You know, you're in a controlled environment, it's safe. I've been admitted to many emergency rooms for suicide attempts. And I've seen psychologists, psychiatrists. I've been on different medications off and on. So it's quite a few things. I think one of the best things I would say is support groups. I mean, there's nothing better than another person helping a person. I mean, it's the best thing, and especially to be around other people that are going through the same thing as you or suffering the same as you, that have the same understanding, along with a professional. In the UAE and the Arab region in general, there is nothing like it. As much as I searched on the internet or in any other place to find a support groups, they just don't seem to exist. So, you know, you can always go to a doctor or a psychologist, psychiatrist.
So her main problem was that she couldn't get the help that she needed. So what is your advice on this?
I'm not sure how she went about getting the help that she needed, but I know there's quite a few centres in Dubai, there's quite a few therapists that, you know, and also with therapy it's a very personal relationship. You know, you might meet somebody and they might not be the most suitable person, even though they have the qualifications, because of the way the person feels about the therapist. So again...
And doctor, what initiatives are the government taking for people like our caller?